Of course, you're joining us from Connecticut and we are here in New York City. Again, thank you for your time and all of the information that we're going to get, from you on COVID-19, its updates, measures, and much more. Just starting off this interview, currently in the United States, we're looking at about 2.1 million cases. And the numbers I have also reflect 117,000 deaths. It's a really big number. We're also hearing that there is a prediction now for about 200,000 deaths in total by the end of September or the somewhere in fall. I just wanted to ask you a question on how should we be processing these numbers, and what do these numbers truly indicate in terms of flattening of the curve or what's happening with the virus itself?
Sure. So these numbers are scary when you hear about such high volumes. Worldwide, we're talking about over 5 million people that have been affected by COVID. And what happened? Well, the whole world shut down essentially. And little by little, we're seeing an attempt to return to normalcy. So as things open, as slowly or quickly as it may be in certain areas, we are still going to see a rise in the amount of COVID patients that we see. Now, take my area. We're in Connecticut. I'm the director of emergency services for 2 emergency departments, and we had about a week being almost COVID-free, and now we're starting to see a little rise again. Why? Well, we're in phase 2 of our reopening, so as people are out and about, they're exposed to any kind of illness, especially the one we're talking about today, being COVID. So it's important that people understand that despite things opening in your area, whether they have or haven't yet, you still need to keep your distance from other people. You still need to wear face masks in public. You still have to wash your hands, and you have to still take all the measures required to maintain your safety.
Did you ever predict us to have such high number of deaths in the country? And I'm just trying to ask you this question, understanding that we are now predicting even more since the country is reopening. Did you, since you are in the ER and you've had first-hand experience with this, did you predict it would be this bad?
No, I think most people would agree that no one could have predicted this illness being as severe and devastating as it's been worldwide. And we haven't seen an illness like this in 100 years. When you think about, people always ask me, well, we've never seen anything like in human existence. We actually have. The initial flu, the Spanish flu, in the early 1900s, had more cases and more deaths. But what's made us more successful in our ability to reduce as many mortalities as the Spanish flu is the ability to communicate, our technology, because never in our lifetime have we seen a global strategy to try and defeat something for essentially the good of mankind. So the whole world, from the United States to India to everywhere you can think of, has made some strategy to try and introduce high-level safety measures to protect their population. When we started first hearing about COVID, our first cases were November, December, January, and it really just blew up in March. Could anyone have predicted it being this severe? No, because if you did, we would have been more aggressive on a global scale of shutting things down earlier and protecting our population.
So in understanding this virus itself, Dr. Vohra, could you give us some updates into, what is it that it's doing, that the impact continues to be so massive? And, when you are practicing right now and you're treating COVID-19 patients, what are some of the uncertainties or challenges that you are facing in terms of patient care or in terms of just treating COVID itself?
Well, the first challenge is just the personal protective equipment. Some people have it, some people don't. New York City has been devastatingly affected by the lack of personal protective equipment, and they are getting reinforcements and have gotten reinforcements, but that was one. I mean, imagine coming to work knowing that you could be exposed to a deadly illness and not having the appropriate gear to protect yourself and hence protect your family and loved ones. That was part one. Now, most places have the appropriate amount of PPE but it's exhausting to put it on every time you go into a patient room. What does that mean? I'm putting on a face mask, maybe an N95 under that, another face shield on top of that, a gown, gloves, all of this every time you go and see a patient. And if you're talking about a long, busy shift, it gets pretty exhausting. And we're seeing sometimes some people lax in this PPE to make sure that they're protecting themselves. So that's one area of burnout and concern. But all we can do is continue to educate and recognize that although these patients are not coming in with COVID as often anymore, that potential is still there. Because it could be anyone with a cough, shortness of breath, flu-like symptoms, runny nose, cough, congestion, even abdominal cramping, diarrhea, and vomiting. So there's so many presenting symptoms that's impossible to truly say, oh no, that's not COVID related, because so much is.
What are some of your biggest concerns with reopening? We're looking at phase 2 of reopening in many areas of the country. Some are moving even ahead. We're seeing at least 21 states that are on an increase of COVID-19 cases. Where do we stand in this reopening, and what is its true impact on COVID-19?
I think it's necessary to reopen. I think we all are tired of being stuck indoors, and I totally get that, including someone that has 4 small children. We need to be outside. But I think what's important to remember is, even though things are reopening, that's not to say we're just going to go back to the way things were and have huge gatherings in the streets and not maintain our safety measures that still need to be implemented, keeping your distance from people, wearing your face masks in public, things of that nature. So I think I would say personally I'm pro reopening, but with the understanding that people individually have to take their own health and safety measures into account. It's not just going back to the way things were, it's opening slowly so that we can realize that things have to be different going forward, and they will be different for the rest of the year.
Yes, we're looking at a new standard of lifestyle almost. Wouldn't you say that?
I would. It's unfortunate. It's sad, but the important thing to remember is we've survived this now, and we want to continue to survive this. And to beat this illness, we just have to follow the recommendations.
Let's talk about drug trials, Dr. Vohra, because there has been so much information in terms of various medications we have heard so far, helping treat patients that are critically ill with COVID-19, or just, people being put on drug trials. Even today, we heard about a steroid that is coming up as a very positive news. WHO also released their statement on it. What kind of information could you give us in terms of what is working, what is not working, and how do you see all these drug trials?
So I think it's important for the research to be done in terms of trying to find better medications to care for patients with COVID, to try and find the vaccine for this illness. As a physician, I'm weary to use anything that's brand new right off the market until it's been thoroughly tested. We've heard about steroids and Plaquenil and antivirals and a lot of different medications. And then the trend is people that don't have severe illness want to be on these medications because it's the new fad. So I would say follow your doctor's advice based upon your specific illness and severity of illness. If I have a critical patient that has a high risk of dying, yeah, we're going to try everything possible to take care of that person. If I have a patient with minor illness, meaning they don't have difficulty breathing and they're stable, I'm very unlikely to try a novel or new medication that has risks associated with it. So all of these are on a case-by-case basis. It's not going to be a Zithromax for everybody or this medication for everybody. It's completely individualized to the severity of your illness, and I wouldn't push physicians to give you a medication that you may not need just because you heard that it might help. Because a lot of these medications have side effects. Really, any medication has side effects. So remember to follow your medication advice by your doctor and try not to push for things just because you heard about them. So briefly said, there's no magic cure. There's no magic medicine. There are treatment therapies that are being attempted. There have been some cases that they've been very successful in, and some cases they've been unsuccessful in. So we really have to look at all of the elements of a specific person's illness to make that determination.
Your comments then on vaccination and the importance of vaccine in treating COVID-19, are all physicians such as yourself basically waiting on that vaccine to truly treat the patients? I guess I'm trying to understand what is truly working out here for patients that are suffering from COVID-19.
Well, I think all of us are hoping for a vaccine.
Hmm.
I'm optimistic that the vaccine will be released at the end of the year. Do I have input in the vaccine? No. I'm just hopeful and trying to stay positive. I wouldn't say physicians are waiting for a vaccine. We're all hoping for a vaccine.
Yeah.
Do I think the vaccine, even when it's released, will cure all of COVID 100%? No. But I think it'll be a significant impact on the disease itself and the volume of the disease that we're seeing.
Would it be important in eventually having a cure for COVID, as they're saying, or are there some concerns that the vaccination may not work for every strain that may come for COVID-19?
That's always a worry. That's always a worry. When I think about vaccines and the flu vaccine, for example, we know the flu vaccine had a huge impact on caring for patients with the flu, but it's not 100%. So it's still, we'll have to see once it's released the actual impact it has. I'm sure it will be a positive impact, but do I think it will eradicate this illness altogether? I'm doubtful, but I think it's going to have a significant impact.
Another very important question that we are getting here at ITV Gold, especially with our South Asian viewers, is questions on at high risk patients and their interactions with COVID-19. What could you tell us about it? And what are some advice that is important for these high risk patients, patients that have diabetes, high cholesterol, that have heart diseases, lung diseases? These are very prevalent issues amongst our community.
Yeah. I think first level is lung disease, okay? If you have chronic obstructive pulmonary disease, or if you have a chronic lung problem, I would say you are probably the highest risk population. And although things may be opening slowly in your area, but I would still maintain my quarantine, okay? Those are the people that really shouldn't be going out. Other high risk patients are diabetics because they have so many areas of their body that are affected by diabetes. So I would also tell them that they are pretty high risk and should consider staying home until they see the reopening entirely in their area and also how it's affected others in that area. For example, as New York City reopens, if I have a history of chronic obstructive pulmonary disease and CAD, meaning heart disease and diabetes, I'm going to stay home and watch what the numbers show, because if I see a major resurgence in my area, I've got to stay home. I can't be a part of that resurgence because I'm already immunocompromised in comparison to healthy people. And keep in mind that COVID has also affected the healthy. So I would still exercise extreme caution if you have comorbidities.
What about actually seeing a doctor during this time process? A lot of these patients have routine, visits to the doctors to maintain, a lot of medications to maintain. What are your comments on that and the maintenance of that?
First, you should be seeing your doctor. It is safe to see your physicians. You can either do a telehealth visit, telemedicine visit, or many doctors' offices have reopened in certain areas, and they have specific schedules set to keep patients apart from one another, and they're taking increased precautions to ensure it's a clean environment. And another follow-up question I'll just prompt is, if you're not feeling well, you need to go to your local emergency department sooner than later. Don't wait, because what I'm seeing is people are getting worse and worse at home, and then they come in too late to be saved. So if you don't feel well, you're having shortness of breath, you're having chest pain, you're having abdominal pain, you're having any major concerns, go to your local emergency department. My emergency departments that I've overseen have reduced their volume by over a third. So they're open, they have plenty of beds available. You should be able to get in quickly and screened and cleared. You can be discharged quickly, but the goal is obviously to prevent death and promote wellness and health. So don't hesitate to come in and see your local emergency departments.
Another important question that I like to ask physicians at this point in the interview is on racial disparity. This is something that we have spoken about in the healthcare system a lot, since COVID-19 has impacted the nation. Have you noticed that racial disparity in terms of the patients that are coming into your emergency departments? And if so, what are your comments on the healthcare system and the disparity seen through it?
One of the nice things about being an emergency department physician, an ER physician, is you treat patients of any insurance, any color, anything, and we're completely blinded to what the patient has in terms of their background, their insurance, their income, whatever it might be. It doesn't matter if you're a billionaire or if you're homeless. We treat everyone the same exact way. So we're emergency medicine is an area with no colors and no boundaries. We're happy and a proponent of seeing everyone and everyone equally.
What is needed in the healthcare system right now, according to you, with everything that's happening with COVID-19?
I think what's needed right now is people to recognize if they're not feeling well, they need to seek medical attention and not be fearful of catching COVID because of seeking medical attention. Because we're seeing more people die at home than we've ever seen before. And that's just, many of these deaths are preventable had they come in for care earlier.
You
So
know,
I'd like to see people getting the message of, if you don't feel well, see your physician, whether it's your private physician, or visit your local emergency department for care, because we're ready and open and want to take care of you and make sure that you're okay.
well, that's an interesting point. We actually didn't know that people are not visiting the ER enough, the ones that really need to do that. I really hope that message gets across here through this interview. Dr. Vohra, this has been quite a journey for the entire medical community across the nation. And I'm sure with your experience in 2 emergency departments, this must not have been easy. I would just like for you to reflect upon how this has been personally for you, and the impact of being on the front line right now, having a family, and also treating these patients. How are you balancing everything?
So it's a great question. Before COVID, I've been the director of emergency departments varying in size from 10,000 visits a year to over 80,000 visits a year.
Wow.
And my biggest concern in terms of well-being was trying not to take my work home with me. And that's from a stress level. That's from a well-being level. Now with COVID hitting, my fear was, oh my God, not only can I contract this illness that could hurt me, that could kill me, my biggest fear is taking it home to my 4 young children and my wife. So it is a game changer in realizing that we're all mortal and we're all at risk, and that I personally could be a vector for illness for my own family. And that was a very scary thing to perceive and then have to accept, and then to try to do everything within my power to ensure that I was trying to be as safe as I could for my family. And I know many providers that separated themselves from their families for weeks at a time out of fear that they could take the illness home, so they didn't see their families for weeks and sometimes months. So it's a tremendous psychological burden on the entire healthcare industry, and my hat goes off to everyone that's fighting this battle in healthcare and as essential staff members, even outside of the hospitals, whether it's stores and groceries, because we all have to fight this together. But I think that's been a very big challenge, and I'm very relieved that now we're seeing the numbers improve and reduced in terms of COVID. And although we know that there's likely to be another spike, it should not be as severe as the initial.
What's your message out to the entire medical community, your staff that works with you, everyone that's really worked so hard in the last few months to really beat COVID here? What do you have to say to them?
I would say to my staff, my teams, and all providers and healthcare workers out there, I'm one of them. I'm one of you, and I'm so proud of the work that you're doing, the work that we're doing, that we're selflessly putting ourselves in danger to make sure that we're helping others. And that's kind of why we always got into medicine in the first place, to help others, to put others before ourselves. And somewhere along the lines, that got lost in translation. It's interesting when you think about India in comparison to the U.S. In India, I think there always was a respect for those in the healthcare field. In the U.S., that's always been lacking. And suddenly now with COVID, when you see ER physicians dying and ER nurses dying and people really being affected by this on the front lines, people have suddenly noticed that, oh yeah, these people put their lives on the line every day. Because it's not just COVID, it's Ebola, it's smallpox, all of these things that trickle into our emergency departments. You don't know the patient you're seeing until you see them. And by the time you've seen them, if you didn't take protective equipment in with you, which you may not on every case, you've already gotten exposed to it. Yeah. So I would say keep doing your thing, keep up the good fight. I think the entire world appreciates everything that you're doing, that we're doing, and there is a light at the end of the tunnel. Things are getting better, things are going to get better, and we're almost there.
As the director and as somebody who has so many staff working under him, what is your focus for the next few weeks, especially as we are reopening and as certain cases are going higher? There is, as you said, there's a warning for the second wave. What are you focused on completely?
I'm focused on making sure that we are prepared for another surge. Not only COVID, but in total ED volumes. So what do we do when we go back to our normal volumes, or perhaps higher than normal volumes, and preparing for what we haven't seen yet? So thinking outside the box and preparing for the unexpected is what's on my mind right now.
Well, it was so great having you here, Dr. Vohra, with us. Thank you so much for providing us all the information. I would love for you to give one last message to our audience, perhaps some tips that they should follow in the next few weeks.
Sure. So make sure you all have face masks when you're leaving the house, frequent hand washing. Remember that COVID is not only spread by the mouth or by particles, but it sits on surfaces also. So if you're at home, make sure you're bleaching down your surfaces. When you're out, make sure you wash your hands after you touch anything, and just minimize your risk of exposure by minimizing your time around a busy population. Being outside on your own, distant from others, is perfectly fine, and I think it's important to get outside the house and make sure that you eat right and exercise, but just remember to avoid unnecessary gatherings and be safe out there.